Welcome back to On the Edge. We're talking about toxic dentistry exposed, and it's got your fingers twitching on your mobile phones. Here's Melissa to explain what you've been saying.
Thank you, Alex. Denise has kicked things off by saying, do dentists have an obligation to return the gold from capped or filled teeth when they are replaced? Think I've paid for their skiing holidays. And she also asks, do you think MS is a mercury-generated disease? Stuart in Bristol says, what's the safest way to remove mercury from our bodies? And several people have texted in saying, what do you use for fillings instead of mercury amalgam? And what's your opinion on fluoride?
Oh, well, there we go. So if we talk about mercury removal, then that sounds a good place to start. How do you do that safely then? What's the key?
There are several protocols that dentists use. I mean, we treat mercury as a radioactive material, especially since I'm so sensitive to it.
Right.
So we wear special mercury gas masks that we're doing it. Then we have to wear eye protection and then special gloves. We make sure the patient has eye protection. They make sure they're breathing oxygen when they're doing it. We have to take the fillings out in a particular way using a particular suction apparatus to minimize the exposure to mercury.
So how do you get them breathing oxygen if you're working in the mouth?
Well, they do it through a nose piece.
Right, right. Simple answer really if I thought about it, but there we go. And in terms of different ways of filling teeth, loads of different compounds available, so whichever ones are on the market and which ones should people be steered towards?
Well, that's a very good question. We don't use any metal at all in the practice, and we haven't done for years. We say there's no need for metals. So there's a variety of materials out there for different situations, but the basic one is, say, the white filling material, which is composite, of which there's various different brands. That's not to say there aren't problems with composite, but it's a lot safer from a toxicological point of view than the mercury amalgam. Because
isn't there sort of something about these fillings have bisphenol A as part of them, which again is another one of these sort of spectres that has come out across society. I mean, it's actually in the plastic in water bottles, I believe. So you know.
That's true, and it has been considered a problem. But we were actually part of a group that did a safety assessment on composites. And what we found was that composite fillings were actually 200 times safer from a scientific point of view than the amalgam alternatives. So
that research is on the table for anyone in the profession to actually inspect?
Yeah, it's fairly new. It only came out in 1995, so it's only been out there like 15 years, so perhaps not many people have read it yet.
There was something which my dentist actually said to me, which has just come to mind, you speaking about that in fact, for a dental practice to use mercury, they have to jump through all sorts of hoops in terms of disposal facilities and all sorts within their practice, so that they're actually out of pocket using mercury-based fillings.
Yes and no.
Right.
It's an advisory that they should use special disposal methods for getting rid of mercury, but it's not compulsory.
Right.
Certain countries there are legislation in place, like Germany, where you have to use amalgam traps to get rid of the mercury. In this country it's advisory, it's not compulsory, and in fact most of the dentists in this country, the last survey, don't use anything.
Right, okay, so they're ignoring all advisories and advice and the science from what you're saying.
Yeah, well, each dentist has to take it and view their own profession to their own conscience. We regard it as it's literally like radioactivity, and so we won't let any mercury go out of into the sewer system or out into the environment, because mercury doesn't degrade; it's there forever. Once it goes out into the environment, it's there forever. You can't recover it.
So, I mean, I have had my mercury fillings removed and replaced with what I suspect are composites. So I wasn't aware of my dentist doing anything along those lines when he changed the fillings over. So is there anything I should be concerned about because of that?
Well, it depends on your own genetic type. We see patients who come to us who've had their mercury fillings taken out and have gone from healthy to sick because of the exposure to mercury from a conventional dentist just taking them out without any precautions.
Right.
So we would say if anyone is considering having their mercury taken out, they should see someone who is extremely experienced in this and should ask them what protocol they use to protect the patient. Of course, the dentist is poisoned by this stuff too.
So if you basically say what protocol will you be using, if they quake in their boots, it's time to find another practice.
Yes, and this is really what we want patients to do, because this dentists will be led by the economics. The more patients will walk out the door, then the more dentists are going to look at it. What do they need to do to attract the patients? So yes, that's a good question.
I mean, that certainly is something which immediately struck me reading about your work and experiences. You are in the situation where this is novel, this is different. I would suggest it's marketable, and I cannot believe that this hasn't sort of kicked off a franchise and got some dentists to break cover and join you on this side of the fence, if you like.
Well, there are lots of dentists that are beginning to show interest in what we're doing, but obviously it's fast step thinking, you know, how can you adapt your practice to actually do the way we're doing. But as we say too, that it's very rewarding doing it our way, because we might just see one patient during that week.
Right.
And when you do a complete rehabilitation on them, then obviously that's very rewarding, seeing that from beginning to end, make sure that you get rid of all the metals, and that you also sort out the infections and make sure that everything is sorted out. And one thing that Graeme didn't mention when you take precautions for having amalgams out is that you actually make sure that a vitamin C infusion is given at the same time. And we will not take out any mercury without that being the case. And we know that using high dose vitamin C together with glutathione, which is a protein that that really quenches or grabs the mercury as it's being released, because no matter what you do as a dentist, you will expose the patient to a lot of mercury vapor.
I've got this vision of these chemicals being like the home guard in Dad's army, and basically the mercury doesn't light it up when it's sort of escaping into your body when you're doing that process. Then.
Yeah, well, mercury gets everywhere. I mean, from the mercury vapor picture that you saw there, 20 seconds after that mercury vapor hits the lungs, it's measurable in your brain, then it goes to the heart and kidneys, lungs, spleen.
20 seconds?
20 seconds is all it takes. You know. So the experiments are out there, the science is there, we've done those. And of course it goes through maternal cord as well. So the baby actually predisposes, so any pregnant woman who's exposed to mercury, the baby will act as a sponge and suck up the mercury.
Goodness me. So we're having babies being born with mercury contamination, nay poisoning,